Back with Dr. Kahan. Dr. Kahan, let's talk bunions. I think my father had the best cure for bunions. He's not a podiatrist. He's a mechanical machinery engineer turned restaurateur a little bit later. But he bought a new pair of shoes and he went home, and the first thing he did is he cut a hole in it. And I think it worked wonderful for him. So do you have anything to add? Or did I just tell your viewers everything there's to know about bunions?
I'll tell you just gave away every trade secret I have, and I only have one for bunion, and that's it. If you've got a sharp pair of scissors, just cut the side out, and it's all solved.
It's all solved.
That's great. That's just great. The irony of that is, I think I've seen your dad in my office. I've had oh my gosh. Bunions. Yeah, you know, a viable option, just cut the side out of the shoe? No, probably not as much as figuring out what was the bunion caused by. Is it the way you walk? Is it a genetic predisposition? But once a bunion starts to hurt, though, I'll tell you what, it's really difficult to avoid surgical correction. We can buy time. If a patient has a painful bunion and they're in a situation where they really have to have conservative care, we can work with it. We can hold off on that probable surgical intervention for, maybe a couple years, utilizing either a cortisone injection, changing some things in their shoes, adding an orthotic that can take the pressure, change the pressure sensitivities of the foot, redistribute the weight on the foot to take the pressure off the bunion. But once a bunion starts to hurt, boy, that's a bad sign. And I just made a bunion with my thumb. Let's see, can we see that there?
Yeah.
So the big bump on the side of the foot, sometimes it's not the size of the bump that determines the severity of the bunion. We probably all have a family member or have seen people that walk around with that big bump on the side of their foot. And guess what? They don't have a problem at all. It doesn't bother them once, and they're, 75, 80 years they've been living with it. Guess what? Don't touch it. If it isn't broke, don't fix it, right? That's my general philosophy for bunions. But once they do start to hurt, or if a patient is young enough, and I tell you what, a child with a bunion, that happens quite frequently, and we can slow down the process. If you're watching this and you know that your kid has a bunion and they're 14, 15, 16 years old, and you look down at your foot and you're, 40 or 50 years old and you haven't had surgery, guess what? Your child is headed down that same road. We can slow down that process. It's going to take a specialized custom type of insert to slow that process down. But now's the time to do it. But once you get older, and assuming the joint still functions properly, we can buy a little bit of time, but once the pain starts, it's unfortunate, but you're likely headed for it.
So let's assume we have to do surgery. So has technology improved? Is doing the surgery today the same than it was for our grandparents, or not?
Oh, absolutely, it has changed. The procedures themselves are still similar, but it's the way to fix the bunion or realign the bones that's changed tremendously. Whether it's something as simple as putting in a screw, and sometimes if you have to put a tiny screw in, it stays in there permanently. You don't know about it, and no, it does not set off alarms at the airports. You don't have to worry about that. There are pins now that they can put in that are absorbable pins. In other words, the pin goes in, and in 8 to 12 weeks, it disappears all by itself. There are situations also where if a pin has to be placed in permanently, or even a joint implant, if the joint has been destroyed due to arthritis in the joint, the bunion's been around for a long time. Joint implants are now using a very lightweight. I just lost my train of thought, but it's right here. Can you read that on the tip of my tongue? There's a type of implant, titanium. That's what I'm looking for. A phenomenal product, a phenomenal advancement in joint replacement for the toe. Imagine that. You can replace almost all your joints now, including your toes. and restore normal function to your toe. A normal active individual, 40, 50 years old, wants to stay active. You don't want to have a bunion, put you back in the easy chair. No, we can fix that. You can replace the joint and boom, 8 to 12 weeks down the road, maybe a little bit longer, recovery-wise, physical therapy, doing the right thing, getting your shoes in order. You can be right back at your regular activity before you had the surgery.
Beautiful. Now let me ask you this. If a person has a bunion, which hurts him, maybe it's the same if it doesn't hurt him, but he decides to live with the pain. He kind of says, I don't want to be 4 to 6 to 12 weeks out of commission. I don't want to do surgery, blah, blah, blah. Does he suffer effects above and beyond the pain? He has the pain. We got that, and he knows that. But does he tweak and twist his leg in a way that he now is bargaining for other problems in his body?
Helmut, that's an excellent point, and I'm glad you brought that up. I'll tell you what, is there any wonder that 75 to 80% of people in this country have a back issue? Maybe it's a genetic issue. Maybe it was caused by trauma, but so many problems that start down in the feet. Perfect example is a bunion. It hurts. So what do? You walk differently. You sway this way or that way. You hold your foot this way or that way. How can I position my body and my foot so I don't have pain anymore? There's plenty of ways to do that, but now guess what? Now all of a sudden your ankle hurts, or your knees hurt, or your hips hurt, or your low back starts to hurt. I've read articles.
Dr. Kahan, that's no problem. We have titanium. We can fix the knee with titanium. We can fix the hip with titanium. If your DMJ goes out because of it, and you lose all your teeth because of it, and they need to be replaced, we have titanium. We have titanium, doctor.
You have titanium, and I'll tell you what, that's the wrong philosophy. Don't go there. Don't think that way. Correct the problem while it's correctable down at your feet, not as it works its way up all the way to your TMJ, which is a possibility. There's articles out there that relate foot and ankle issues causing you to walk funny, and next thing you know, you will have TMJ. It's phenomenal. It's unbelievable. Yes, the bones are all connected from here all the way down to the foot. Fix it before it's too late. Believe me.
No, actually, I have talked to a bunch of dentists, and even though there are many reasons why one can have a DMJ problem, which the DMJ problem in itself, again, is pain here, and it's crooked looking and all kinds of things, but it's migraines, shoulder pain, back pain going down. So many dentists actually will tell you that they will involve chiropractors and podiatrists to fix the DMJ, because sometimes they have no clue anymore where it started, but the truth is the jaw can throw out the foot, and the foot can throw out the jaw. And once they're both thrown out, who cares which one came first? You need to fix them all.
You got to fix them all. Exactly. Excellent point. Absolutely.
From your case, quite often, anyway, the feet are out. I have heard, I don't know whether that's true, and it might not have anything to do with bunion either, but that there's barely a person around who has really even legs. We're all a little crooked, I guess. I don't know whether that's true, but I've heard so.
I think that is basically true. And typically, though, an eighth of an inch or maybe even as much as a quarter of an inch, the body can kind of compensate for that. That's why if you go to if somebody goes to a chiropractor, you could go to the chiropractor every day and get your body adjusted, and there would be something out of alignment. And, that could be due to that very slight leg length discrepancy, just as well as that most people have one foot that's longer than another. Yeah, is that as critical as having a leg that's longer or shorter? Possibly. Anything that's going to change the way you walk or your positioning has the potential to have a tremendous effect on the body.
Right. Well, anyway, a bunion, especially if it hurts, I assume, but it might even be when it doesn't hurt simply because it's misgrown. You will behave different, you will twist and tweak your leg different, and it will go right up to the knee, and you'll go right up to the back and to the shoulder and to the head, and next thing you know is you try to go to a neurologist for your headache when it really came from about 30 years walking crooked with a bunion you learned to live with.
Yeah, exactly. I mean, the moral of the story is if you look down at your feet and something doesn't look right, get it checked out. What's the worst case scenarios? I'm going to say, you know what, it's no big deal, or it's probably not a big deal. Just do this, and you'll live a great, healthy life for the next 15, 20 years. And if something comes up...
Beautiful. Learn something new every day. Thanks for your insight, Dr. Kahan.